Have you ever walked into your poultry house and seen birds with strange wart-like growths on their combs? Or worse, gasping as if something is stuck in their throat? Could that be just a minor infection or something more serious? Let's talk about it. So, what exactly is fowl pox? Fowl pox is a common viral disease of poultry, chickens, turkeys, pheasants, and even wild birds. It's caused by a group of avian pox viruses with different strains like fowl pox, turkey pox, and pigeon pox. Do these strains matter? Yes, they do. But here's the twist. They are somewhat related, meaning there's a degree of cross-protection, but not complete. So your birds are still at risk. Which birds are most affected? Technically, birds of any age can get infected, but the most vulnerable group, birds around 8 to 10 weeks old. How does this virus spread? This is where it gets interesting and a bit worrying. The virus is incredibly resistant. It can survive for a long time in scabs and dried lesions. So transmission happens through direct contact between birds, contaminated feed and water wounds from pecking, and very importantly, biting insects like mosquitoes and mites. So, is it seasonal? Absolutely. You'll see more cases during wet and hot weather when insect populations are high. Anything that causes skin injury or stress, like pecking or immunosuppression, increases the chances of infection. Now, how do you recognize fowl pox in your flock? Here's a key question. Does fowl pox always look the same? No, it comes in two main forms, and sometimes both appear together. 1. The dry form, cutaneous form. What does it look like? You'll see wart-like, nodular lesions on comb wattles, eyelids, earlobes, legs. Other non-feathered areas. They start as small yellowish spots, then turn brown, and eventually form dark scabs. Any complications? Yes. If lesions form around the eyes, birds may go blind temporarily because the eyelids can completely close. And here's something farmers often overlook. When those scabs fall off into feed or water, they can infect other birds. How long does it take to heal? Usually about 3 weeks. 2. The wet form, diphtheritic form. Now this is the dangerous one. Why? Because it affects the mouth, throat, larynx, and trachea. What do you see? Yellowish, cheesy, necrotic membranes forming inside the mouth and airway. These can grow, merge, and form plugs. And what's the biggest risk? They can literally block the airway and choke the bird. This is the main cause of death in this form. What about overall performance of the flock? Even when birds don't die, you'll notice weight loss, poor growth, reduced egg production. The disease typically runs for 3 to 4 weeks, and mortality is usually low, around 1 to 2%, but losses from poor performance can be significant. How do you confirm it's truly fowl pox? In most cases, diagnosis is based on flock history, typical lesions, dry form, look for warts on comb and skin, wet form, look for lesions in the mouth and airway. For confirmation, lab tests like histology can be done. Now the big question, can you treat fowl pox? There's no direct cure for the virus, but you can manage it. What can you do? Carefully remove warts or membranes. Where possible, apply iodine or gentian violet to lesions. Use topical sprays, like oxytetracycline sprays, to control secondary infections. Give antibiotics like penicillin, streptomycin, or amoxicillin. Can vaccination help during an outbreak? Surprisingly, yes. If less than 20% of your flock is affected, you can still vaccinate the remaining birds immediately after isolating the sick ones. And birds that recover, they usually develop strong immunity. So, how do you prevent fowl pox completely? It comes down to 3 key steps. 1. Vaccination. Use the wing web method in chickens at 8 and 12 weeks. In turkeys, use the thigh stab method. Always check for a vaccinal take after 7 to 10 days. A small nodule at the site means it worked too. Insect control. Reduce mosquitoes and mites. They are major spreaders. 3. Good hygiene and disinfection. Clean housing, equipment, and proper biosecurity. So next time you see those harmless looking warts, ask yourself, are they really harmless? Because with fowl pox, what starts on the skin can end in the airway. Stay observant, act early, and protect your flock before the virus settles in.